Hi, good afternoon. My name's Danny. I'm a pharmacy intern. Are you Amy?
Yes, I am.
Hey, Amy, could you just verify your date of birth?
January 1st, 1997.
Perfect. So, Amy, I have a new prescription here for a Levemir Flex Touch pen. It should only take about 10 minutes to go over the instructions. Is that okay with you?
Yeah, that's fine.
Perfect. Do you mind if I open it and kind of show you the ins and outs of it?
Yeah.
Awesome. So, what did your doctor tell you this prescription is for?
Something about diabetes.
Correct. So this is a long-acting insulin pen that will help to manage your diabetes. How did your doctor tell you to take this medication?
He didn't tell me.
No worries, that's what I'm here for. So this prescription is written for 10 units to be injected into your skin every night at bedtime. It comes with 3 pens and 3 refills. Have you ever used insulin before?
The vial and the syringe.
Okay, no worries. I have a lot of patients who are switching over from the traditional vial and syringes, and now using this flex pen, and they've actually found it a lot easier and a lot less irritating. So I hope you have the same experience. Next, I'm just going to show you how to use the insulin pen. Okay. First, I want you to start off by washing your hands with soap and water. Next, you're going to remove the cap and verify that the insulin is in fact clear and colorless. Once you verify that it's clear and colorless, I want you to then check to make sure that you have the right insulin. It should say Levemir Flex Touch Insulin. Then you'll take the pen needle and put it on top of the insulin pen by pushing it straight forward and twisting it until you hear the click. When you hear the click, you can now remove the outer cap. Save this outer cap for later. You'll then remove the inner cap and discard this. That can just go in the trash. It's always important to remember to prime your insulin pen each and every use. You're going to do this by dialing it up to 2 units and by pointing the pen upward, inject the insulin to make sure it comes out of the pen. Now it's primed and ready. Next, I'm going to show you how to inject it into your abdomen using this sponge. There are other areas that you could use, such as your thighs or your arms or your buttocks, but your abdomen is going to be the best, most preferred location for you with the angle that you're going to be injecting it. So if the bottom of this sponge is your navel, you want to go 2 inches above your navel and always 2 inches away from the most previous injection site. You'll take your insulin pen and dial it up to the prescribed dose, which in your case is going to be 10 units. And holding it in your dominant hand and your thumb on the top button, you'll go in at a 90-degree angle into your abdomen. Then you'll push the button and hold it down for 5 to 10 seconds. After 5 to 10 seconds, you'll withdraw the needle from your abdomen and then let go of the button. You've now successfully injected your first dose of insulin using the pen needle. Next, you're going to remove the pen needle cap using the outer cap that we saved earlier, putting it back on top and twisting it off, and then discarding it into a puncture-resistant, hard-sided container with a cap. In the state of Colorado, you are able to use this, tape the sides, and then throw this container into the trash. Remember, it's always important to use a different pen needle each and every use. Now that you have your pen needle off of your insulin pen, you can put the cap back on and put it in a safe storage place. You can keep the currently used insulin pens at room temperature up to 42 days. The unused pens should be kept in the refrigerator until their expiration date. Just so I was clear, where will you keep your currently used insulin pens?
And somewhere safe, but it doesn't have to be in the fridge.
Correct, at room temperature. Since there are needles and I would keep it away from kids and children and pets. Also, make sure it's a dry and safe place, okay? How long can you keep the unused insulin pens?
The unused until their expiration date.
Correct, in the refrigerator. What did your doctor tell you to expect using the insulin pen?
I honestly forgot.
No worries. So using this insulin pen, you should notice lower blood glucose levels within about a week. Also, I just wanted to verify, do you remember how many refills you have?
No.
You have 3 refills, don't worry. And how many units will you be injecting into your SIN?
10.
Correct, good job. Some common side effects of insulin pens or insulin in general are hypoglycemia and weight gain. Some common signs and symptoms of hypoglycemia include blurry vision, dizziness, headache, hunger, fatigue, those kind of things. Some common causes of hypoglycemia include skipping meals, delaying meals, not eating enough food, over-exercising without eating enough food, or even injecting too much insulin at one time. If you are ever feeling those side effects of hypoglycemia, like dizziness, headache, blurred vision, I want you to check your blood glucose levels using the glucometer. If it's below 70, I want you to eat 15 grams of carbohydrates, and that could be in the form of a half a glass of fruit juice, it could be 6 lifesavers, or even 3 glucose tabs. Wait 15 minutes and then recheck your blood glucose levels. If it is still below 70, I want you to repeat that process of 15 grams of carbohydrates and waiting 15 minutes and then rechecking your blood glucose levels. If it's above 70, you can eat a small meal and kind of just monitor your blood glucose for that day. I know that was a lot of information, but just wanted to make sure. What goals did you and your doctor set for using this insulin pen?
I don't know.
No worries. So you want to make sure that we keep our blood glucose levels before meals at around 80 to 130, and then after a meal below 180. All right. If you ever notice that your blood glucose level is above 400, that's a sign of hyperglycemia, which just means you have a lot of sugar in your blood. That's when you want to reach out to your doctor. If you find that you're constantly and frequently having those hypoglycemic events, that's also a sign that we need to reach out to a doctor and kind of change up the insulin dosage. What questions do you have for me today?
How much weight am I going to gain on that?
It shouldn't be too much. Most of the patients that I speak with, maybe 5 pounds.
Okay, because I'm trying to lose weight, so...
Well, be careful if you're being physical, because that could cause hypoglycemia, like we said. Remember, I'm always here if you ever have any questions. My name's Daniel, but any one of our interns or pharmacists here would be more than happy to help, okay?
Okay, cool.
Thank you so much for your time, Amy.